This segment of DelmarvaLife is sponsored by TidalHealth.
Well, you've probably been to an ear, nose, and throat doctor before, maybe for something common like strep or maybe an ear infection. What you might not know about is an otolaryngologist.
I'm very proud of you. That's awesome.
I'm not sure. I think it's otolaryngologist. I think I said it wrong. The medical term for an E.N.T specialist is that they are experts in surgery and other medical issues.
I'm just thankful that you're the one who had to say that. And those issues can actually lead to various forms of cancers and tumors as they present themselves in the head and neck areas. And wouldn't you know it, TidalHealth has an expert with years of clinical and research experience on their team. We would like to introduce you to Dr. Julie Berry. She is with the ear, throat, and nose surgery team at TidalHealth.
Good afternoon.
So, give us an overview of the services offered by TidalHealth ear, nose, and throat surgery.
Sure. Well, we offer the full range of management of ear, nose, and throat conditions. It could be ear and hearing loss problems, sinus and nasal problems, throat swallowing issues, and of course, as you've mentioned, benign and malignant tumors of the head and neck. In particular, our thyroid, parathyroid management and kind of our approach to head and neck cancer management is probably, arguably the most advanced in the region.
Mm-hmm. So what role would an E.N.T specialist play in managing that?
Yeah, well, an ear, nose, and throat specialist is oftentimes the first provider that a patient engages if they have a lesion or a growth or tumor of the head and neck. And our goal is to kind of develop, really immediately, because of the patient's kind of worry about the situation, a real comprehensive care pathway. This begins really with the diagnostic part. It could be making arrangements for biopsy, imaging, expediting referrals to our oncology colleagues if needed, and sometimes the definitive treatment is actual surgery. And if there's options, we want to give that, we want to elucidate that to the patient so they can be involved in the treatment decision-making process.
Yeah, and there's been so many big advancements in medical and surgically in the surgical realm.
Yes.
What roles do you offer to play in the treatments, like those new advancements?
Well, certainly from an actual surgery or intraoperative standpoint, we offer image-guided sinus surgery, which is in essence kind of a three-dimensional rendering of the patient's sinuses up on a computer screen. It serves as a roadmap for surgery. It allows more efficient, safer, more meticulous surgery. We offer a whole variety of kind of narrow field approaches, endoscopic approaches, other minimally invasive approaches to various tumors, throat problems, mouth problems. In an office procedure standpoint, that's also driven by kind of precise techniques from our nose and throat endoscopies, even all ear examinations and all ear treatments in the office are done with an operating microscope or a surgical microscope. So even earwax or cerumen removal is done real meticulously with the surgical microscope.
Wow. And I imagine no two patients are alike, so you offer personalized care. That's important, isn't it?
Absolutely important. Really, the art of medicine is that patient-centered care, and whether it's it's my responsibility to be aware of their other medical problems, medications, how those implicate or the treatment decisions for their head and neck, ear, nose, and throat problems. Involving them in options, a decision on options, being sensitive to their concerns, their preferences, keeping open the lines of communication. I consider all of that the artistry of that patient-centered approach. So it's important.
And how do you utilize MyChart?
Ah, yes, I love MyChart. There's a lot of benefits of MyChart. Even from appointment scheduling, patients can self-schedule through MyChart, appointment reminders. They can communicate with the office, with me. They can review their results online. They can review the visit notes online. My favorite part is something called the AVS, or the after visit summary, and that is where I input information. The system automatically inputs some other information, so patients can, later that day or the next day, they can sit down and refresh themselves on what was discussed at the visit, what the next steps are, little reminders on what the upcoming tests that we've arranged for them are, what the medications were.
Oh, that's wonderful.
AVS, it's my favorite part.
Don't have to sit there and take notes when you're in the doctor's office
well,
anymore.
They say that patients only remember 35% of what's given to them or discussed with them at a visit, and that has been repeatedly proven in studies, and so it's really amazing that it's taken us, the world this long to come up with these things like MyChart and after-visit summaries.
Well, you mentioned making appointments through MyChart.
Yes.
Can someone get an appointment with your department?
Well, they can call the phone number directly, and my wonderful front office staff can make those appointments for them. They can self-schedule if they prefer. Referrals are not needed for most conditions. There's a few conditions that we request referrals on, but even if patients are self-scheduling, we like it if we can have available to us past records. It helps with kind of that more meticulous and focused care. But, all of that contact information is on the website too. I think it's the TidalHealth.com, and it's under, sometimes ear, nose, and throat surgeons can be hard to track down because we have so many different names. But we try to keep it user-friendly at TidalHealth, and so it's ear, nose, and throat surgery as opposed to E.N.T or otolaryngology, head and neck surgery, the real cumbersome one. You did a great job, by the way.
Oh, thank you. And of course, we'll have a link on our website so folks can find all the information they need to learn more or possibly make an appointment.
Yes,
Dr. Julie Berry,
absolutely.
thank you so
Happy
much.
to be here. Thank you.